Dr. Dan Halliday, Medical Superintendent at Stanthorpe Hospital. I'm a rural generalist obstetrician, starting through undergraduate biomedical science at Griffith and postgraduate medicine at University of Queensland. I undertook my internship and residency at Rockhampton Hospital, and Rockhampton was a really good hospital to actually get a foundation for my clinical practice going forward. So my time at the Rural Clinical School based out of Toowoomba was an interesting time. It was in its infancy in that sort of 2001-2002 period. I was very fortunate to undertake the rural terms based out of Toowoomba, but that extended out to time in Charleville and Cunnamulla as a third year medical student in 2001. I think when you're looking at medicine as a field of practice, a profession, got to put it into perspective. Medicine is a challenging field, a profession to work in. You're going to have ups, you're going to have downs. I think what we've actually seen in the last few years actually promotes the field of rural practice in particular quite well. And one of the reasons why is that just the space and the lifestyle components of rural medical practice have come to the fore. And there's a really opportunity for those medical students to actually find their niche in medicine and to try and actually provide a value proposition, not just to themselves, but actually to the communities that they can serve into the future. Because you are valued in rural practice. And there's a very, very high value that communities actually place on the medical professionals that actually respond to the call to practice rurally. Pretty quickly I knew what I wanted to do in terms of going through into rural practice. I had specialists who encouraged me to look at subspecialty fields. But pretty quickly I sort of knew that I wanted to go back to the bush. Even though I was a Queensland Health Rural Scholar and I did have a bonded return of service commitment, I was pretty comfortable with my choice. There's a lot of respect that I received from specialists who understood that I was looking at going rural, and they were very willing to actually empower me to undertake skills that would benefit me in my training long term. Certainly within University of Queensland circles and rural clinical schools, there have been key moments along the way where I've come across key mentors, enabling me to actually create a network of colleagues who I could call upon for advice. There are great opportunities actually for medical schools such as Rural Clinical School in the Downs, and I think that the new initiatives coming out of Toowoomba are going to be really exciting for Darling Downs in the coming years.